Afternoon, Senator. First, let me say I appreciate your efforts on education reform, particularly because that's one of my major issues. You said several things, so I'm going to ask you quite a few questions and try to be quick about it just to make sure I have clarification on the facts and your opinion. So you talked about crime and the increase in crime that would come if we were to pass a bill like this. I guess my question is, many of us could assume that, but where could you point me to demonstrate such a thing?
Thank you, and it's not something I say lightly. I can't say it anecdotally. I can only get it from large files that I have on all the states that are currently have bills like this in place, and what they have found through their law enforcement organizations and their experience both at a state level or a county level where this is in place. I'd be happy to provide that for you.
And let me just say, one of the reasons I'm asking is because I'm sure you're aware that at least many organizations, law enforcement organizations, assume as much, but I think you probably are aware of the RAND Corporation study that happened last year around the closing of dispensaries in Los Angeles. And that crime actually increased after the closing of the dispensaries. And so I guess that's something to think about, but also I'd like to get your commentary on that.
Thank you, Representative. I did read the RAND report, and I found that it had a lot of conflicting information in it. Statistics can show a lot of things. It's just as those my question whether or not the rate of car accidents has gone up, particularly in the area of drug use versus alcohol use. And so I would say that I agree with some and disagree with some of the data in that RAND report.
On the issue of the illegality of doing what we're doing because of the federal government's position, I'm a little bit confused, to be honest with you, about your position, because when you talk about those who would be terminally ill and your, what seems to me, willingness to engage the federal government on whether it's a Schedule I drug or not, I'm not understanding how part of your argument can rest on the fact that it's currently a Schedule I drug at all. So if you could expand upon that a little bit.
Schedule I is a highest level of danger to the public. And along with that, you would get statements by either the FDA or others that would, along with that, say that in fact they have not found it to be medically significant in helping individuals. And yet, I would join with Connecticut, should there be leadership that wanted to do this, to petition the federal government to be able to waive that for the terminally ill. I would imagine that that argument would carry a lot of weight. There's very little that you would want to prohibit from administering to a terminally ill patient if it should be perceived as helping them somewhat, particularly in the early stages of the terminal illness. The latter stages, of course, someone would not even have the strength to be able to take in smoke in their lungs unless it was, again, a spray form or what have you. Should that help to, and I wouldn't say even alleviate pain. This is about not being conscious enough to know how you're feeling at that point. So the jury's still out as whether this really does help to alleviate pain more than it helps to alleviate the feeling of in that painful situation. But I would join together with challenging the government on the fact that it should be used for terminally ill. We would still be at their crosshairs. It could still be denied. And I understand that. I would say the greater good is to protect the general public at large and our young people. On that, I would continue to support the federal government listing as a Schedule I drug. If there's at least something we can show to young people that this is a dangerous direction, even if we decriminalize here in Connecticut, or even if we say that somehow in certain medical conditions that it is okay, I think we still need to be able to tell the public and our students and our children that this is a dangerous drug. It affects the psychology of the brain, it affects the heart, the lungs, and even more disturbing is that there are now medical research that say that the THC, the proponents of this, actually lodges itself in the fatty tissues of both the brain and the reproductive organs, and in fact could affect offspring, and not just in one generation. So that has, for me, a lot of concern, and should there be much more research on this. And I really would support the federal government doing more research on the marijuana plant and the THC in it, and how it can be extracted for good, just as nicotine can be extracted for good in certain cases, and use it in a manner that is safe. It's a safe delivery, and you could actually get this product by pharmaceutical companies, get the aerosol by pharmaceuticals. It could be dispensed properly in the proper dose by doctors. It would be very interesting to see how doctors would come up with the exact dosage of how many joints it would take for a particular malady. I still am scratching my head to learn a little bit more of this, I have to say. I'm sorry about going a little too long on your answer on that question.
No, that's fine. I think we actually want the most clear and concise, and sometimes that takes a little bit of exposition to do. I'll finish up with a comment on what you just said, and then one final question. I recognize and appreciate your response, but I have to tell you that I'm still a little confused by it. You on the one hand say that if there's any value for those people who are at the end of life, then we want to do it. And on the other hand, you refer to the fact that because it's a Schedule I drug, the federal government indicates that there's no value. That, to me, is confusing. And I think either it has value or it doesn't. And I will ask you a question because you talked about the doctor who changed her opinion. But either you didn't or I wasn't clear about it. Why did she change her opinion?
She currently practices, as I said, in Lower Fairfield County, one of our major hospitals. She said that she had not spent the time or the research until being asked to debate this issue on the medical aspects of the bill and the delivery system. And I think that she concluded that the kind of smoke in the lungs and the 400 and some odd ingredients that are in marijuana smoke as well as in tobacco smoke as well would do much more harm than good for their patients. And she came to the same conclusion, that she has now access to so many alternative drugs that are so much more effective, that would not have the negative side effects. In fact, you know that Yale University actually did a study that they had to actually stop. They actually had to stop the study because their subjects that were undergoing this had such negative ill effects from this that they found that it was not in good conscience and ethical for them to continue that study. But I would maintain that we need to do a lot more study of the drug. If there are really good medical uses, then we should use them and in a manner that is a safe delivery. And if it's not, then again, a case could be made before the federal government about what level of scheduling should this be under. But currently, right now, as it stands, there's much more harm than good. I would continue to support, unless we got better evidence of it continuing to be a Schedule I drug.
Thank you. Thank you, Mr. Chair.